Have you ever felt stuck deciding between two treatment options, unsure which is best? What if you could use simple probability concepts to make confident choices every time? Hello, this is Dr. Martin Baxmann, and welcome back to the Lean Orthodontics podcast. When planning treatment, whether it's for a child for functional orthodontics, a teenager needing a fixed Class 2 appliance, or an adult weighing camouflage versus surgical options, we constantly face decisions under uncertainty. We rarely know all the facts at the start. Growth patterns, patient compliance, preferences, and biological variability all influence the outcome. That's where probability theory comes in. It allows us to assess the likelihood of success for each option and make informed decisions without needing absolute certainty. Take a child who could be treated with a twin block or activator. If they are approaching a growth spurt, the probability of success is higher, but compliance remains uncertain. Will the child wear the appliance consistently? Parents may report differently, and we cannot be 100% sure. By assigning probabilities to these outcomes, we can make an educated choice, balancing risk and reward. This is exactly what my ABCD system does. It simplifies complex sagittal treatment planning into 4 primary pathways: A for functional orthodontics, B for compliance-independent bite correction, C for extraction therapy, and D for surgery. Probability helps decide which pathway is most likely to succeed for a specific patient. The beauty of this approach is subtlety. You don't need absolute certainty to act. Even a 51% likelihood in favor of one option is enough to proceed confidently. Applying this prevents paralysis by analysis and keeps decisions practical, efficient, and grounded in both evidence and clinical experience. For example, a 30-year-old patient with no growth remaining will have a low probability of success with functional appliances, making options B, C, or D more suitable. Choosing between them involves weighing small differences in likelihood, patient goals, and clinical judgment. Probability theory also applies beyond treatment planning. It can guide team management, operational choices, and even personal decisions. The principle is the same. Act with logic and confidence without waiting for perfect certainty. Once a decision is made, implement it fully, monitor outcomes, and adjust if needed. Over time, this builds a reliable, reproducible system for decision-making that reduces stress, saves time, and improves results for both patients and practice. Next time you face a challenging choice, remember, partial probabilities and subtle gradations are enough. You don't need to be certain. Use probability theory, apply the ABCD system, and make decisions confidently. Your patients and your practice will benefit from your clarity and efficiency. If today's episode gave you something valuable, subscribe, leave a review, and share it with colleagues. Every small step towards smarter decisions adds up. Thank you for listening to the Lean Orthodontics podcast, and until next time, stay focused, stay curious, and keep orthodontics lean.